An Alabama woman tonight mourning the loss of her mother and wants answers as to why more wasn't done to save her.
She passed away while in the custody of the Alabama Department of Corrections.
He said, "I have been assigned to this post since 2007 and have worked with numerous trustees. I can say without a doubt she has been the hardest working person that I have dealt with."
Michelle Mann was a state inmate at a Birmingham work release. While she was locked up, she earned her degree and was so trusted by prison staff that she was allowed to drive other inmates to their work release jobs.
Mann asked for medical help multiple times before she collapsed and was sent to UAB for emergency surgery, ultimately dying days later. Tonight, Mann's family says the billions of dollars the state's paying to provide health care to inmates isn't working.
Jen Horton investigates.
When you don't have anything left, you have pictures. That was when she was in Montgomery working at the governor's mansion. My mom was an amazing person.
Michelle Mann had a lot to live for. It's hard to know by looking at these pictures she had already spent nearly 30 years in state prison. A third of that at Birmingham Work Release, an ADOC facility for women who have some of the lowest levels of supervision. The place where her daughter says she failed to receive proper medical care.
They just looked at it, said that it was a spider bite, put some hydrocortisone cream on it, gave her some Band-Aids, and sent her on her way.
Christy Mann saw her mother days later when they took this picture. The last time she saw her mom breathing on her own.
I looked at it. It was a red rash on her stomach, and I told her, I said, "Mom, that don't look like a spider bite to me." That following Monday, on June the 12th, she went back to health care. The doctor just looked at it, said, "Oh, that's not a spider bite, that's the shingles."
3 days later, Michelle Mann went back to health care, asking for more help.
She passed out. She lost oxygen. They called the ambulance and transported her to UAB. When I got to the hospital, she was on a ventilator, 100%. They had already sent her in for emergency surgery. They had to remove her spleen. They said that her spleen had ruptured. Her blood was not clotting at all. They had her hooked to a transfusion machine. The hematologist got with me and said that her white blood cell count was 144,000.
Michelle Mann didn't have the shingles. She had leukemia. Days later,
I told them that I wanted to have the ventilator removed. They let me in there to see her for 2 hours. They wouldn't even let me stay at the hospital until she passed.
Christy Mann explained her parents' marriage was fraught with domestic violence for nearly a decade. In 1995, her mother fatally shot her dad. She said it was in self-defense. Michelle Mann was convicted of murder in Walker County in 1996, and the fact that her mom was still in prison is salt in the wound.
Michelle's records were unlike anything we've ever seen. She earned nearly 30 certificates and an associate's degree behind bars, along with dozens of parole recommendation letters.
This one is from Captain T.D. Laird. I for certain feel she would be an asset to the community and to any employer who would give her an opportunity.
But she was denied parole 5 times.
What more could you ask of somebody? And there's never a reason given. They never give an answer.
We filed an open records request with the state parole office to get those answers. It revealed she was repeatedly denied parole due to the severity of the crime and opposition from the victim's family, despite glowing endorsements by those she worked for every day.
We asked ADOC about Mann's medical visits and why she wasn't offered further testing. They tell us that privacy laws prohibit them from discussing it, stating it's up to medical staff to determine if a patient needs further testing. The state-confirmed inmates do receive periodic health assessments, but Christy Mann says her mother hasn't been checked out in years. Jen Horton, WBRC, Fox 6 News, on your side.